Good morning, Dr. Ferguson coming to you from the Passioncam. Hope everybody's doing well today. It's a blessed, bright, and sunshiny day as I travel today. Thought I would do a little series on Alzheimer's disease. A lot of people know it's an issue, know it's a problem, but don't know a whole lot about that particular issue or that particular problem, and don't know that there's help to be had. We don't have a cure, but we do have some treatments for that disease process. So first of all, Alzheimer's disease is a German word. That's why it's called Alzheimer's as opposed to Alzheimer's disease. And when it was first discovered, they weren't sure what they were looking at, and then they began to see a pattern of challenges that we see with the Alzheimer's patient. The earliest or the youngest patient with the disease has been 38 years old. Now, many times a person gets the disease in the 50s, but that's not, I say many times, not very often a person will get the disease process in the 50s. That's usually pretty devastating. But the more common is about age 65, about 3 to 5% of the population will get Alzheimer's disease. At age 75, 15 to 20% of the population will have Alzheimer's disease. And at age 85, 40 to 50% of the population will have Alzheimer's disease. And I'm speaking of the population in the United States. It's very similar in other parts of the world, but I'm really speaking of United States population when I made those numbers just then. Now, when a person first starts coming down with Alzheimer's disease, it may be very difficult to identify it, to diagnose it, and the smarter a person is when they start out, the more difficult it will be to diagnose. Because the smarter the person is, they will begin to make cues for themselves. They may begin to write lists. They may begin to make notes. They may begin to be more organized in their day of things they have to get done. And so you may not notice that they're having challenges if you are not really close to them or not interacting with them on a day-to-day basis. So early on it can be difficult, but the easiest way to diagnose early on is by a close family member that recognizes some small, subtle differences, such as mom used to dress really sharp, and now she dressed okay, but not as sharp as she used to. Or dad never used to lose his keys, and now maybe 2 or 3 times a month, dad loses his keys. Those type of things. So, Dr. Ferguson coming to you from the Passioncam. We're going to continue this on the next time. Be blessed and have a wonderful day.